It's been almost 2 weeks since Dr. Henry announced new health orders for some workers in the province. But it quickly struck a nerve to some who work in the healthcare field. Following Dr. Bonnie Henry's announcement, healthcare workers organized a protest right outside of the hospital on Sunday, all against the upcoming mandate. They told me that they want to make a decision on whether or not to get the vaccine, even if that means putting their jobs on the line.
Does it terrify me? Yeah, but you know what? I'm standing up for what I believe in.
Noram, who works as a long-term care aide, would be one of the workers forced to get the vaccine in order to keep her job. She helped organize a protest, drawing in other healthcare workers wearing scrubs in support. It also drew in other members of the public. More than 100 people in total holding signs and crowding sidewalks as some drivers honked in show of support for their cause.
I mean, that's our own personal choice, and we wanted other people to stand up and show that they support us.
We are okay with wearing masks. We are okay with being tested multiple times a week, although we would like our freedom of choice on the COVID-19 vaccination.
In a press conference on August 12th, Dr. Henry alluded to new changes that could come to all workers in the near future.
We will be working with health authorities, with unions, and determining our path forward for all healthcare workers in British Columbia in the coming weeks.
Which brings up the conversation of a similar mandate that was amended back in 2019. Back then, the BC Nurses Union reached an agreement with the Health Employers Association of British Columbia to end a flu vaccine policy. It would have required healthcare workers to either wear a mask or get the flu shot. CKPG reached out for a comment from the BCNU asking for their stance on this COVID-19 vaccine mandate. They say that they strongly encourage nurses and other healthcare workers to be vaccinated so that it adds a layer of protection. The union added that they believe education is the most appropriate means of achieving high vaccination rates.
It's a little more forceful, because now you've got the government saying, oh, you will or else, and I don't think anyone has that right to say, yeah, it's like, but not the same.
Healthcare workers in long-term care and assisted living facilities have less than 2 months to get the vaccine. And for workers like Lear, she has one message for Dr. Henry.
You cannot dictate to us what we do and what we don't do with our bodies.
Ollie Herrera, CKPG News.